Hey guys, welcome back for another episode of 5 Minute EMS Review, where we offer short and to the point episodes on different EMS topics. Today, we're going to be digging into a new series on EMS medications, where we're going to start looking at different medications that we use in EMS, as well as some different concepts of pharmacology. So, we wanted to start off the series by reviewing the 6 rights of medication administration. So these are 6 things that we want to remember anytime that we're going to give medication as EMS providers. So the 6 rights are the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. So first off, we want to make sure that we have the right patient. Typically, if you are in the field and you have only one patient, this is a given. However, there may be times working as an EMS provider where you may be in a hospital setting, or you may be faced with 2 patients, or even a mass casualty situation where you might be dealing with a lot of different patients. So you always want to make sure that you confirm that you're giving your medication to the correct patient, or if you're assisting the patient with their own medication, making sure that it is actually prescribed to them. That's the right patient. Now, once we've identified that we have the right patient, we want to make sure that we're giving the right medication. Did we choose the right medication based off of the indication that presented itself? So, are we giving the right medicine for the context of the current medical emergency? And in addition to that, did we actually select the proper vial out of the drug box? So, you want to confirm when you pull it out of the drug box that you chose the vial that you meant to choose. And one thing that can be really helpful with this is just to have your partner lay a second set of eyes on the vial to confirm that you have the right one uh, before you give it to the patient. Now, closely linked with the right medication, we want to give the right dose. We want to make sure that we are properly giving the dose. Now, I know I've made a mistake here before where I gave the right dose of the medication for one protocol, but we were actually in a different protocol. So, same medication that could be used for 2 different things, and I was giving it the dose based on one thing when I should have been giving it based on another thing. So that can be confusing if you have medication that can be given in different doses depending on the situation. So again, something that's really important just to double check with your partner, even just by verbally stating the medication and the dose that you're getting ready to give, and having them acknowledge you or challenge you if they hear that you have made a mistake. Now, another thing with the medication and the dose is to make sure that we get the right route. A lot of times, the same medication can be given via different routes, and it's going to affect the patient differently over different speed. Depending on the route given, and it may even have a different dose depending on the route given. So we want to make sure that we've got the right route chosen for the situation, and we're giving the right dose for that route. Right time, we want to make sure that, again, the medication fits the context of the emergency, that we've chosen the right medication based on what is happening with the patient. We also want to think about the timing of delivering the medication to the patient. Some medications are meant to be a slow IV push. Other medications have to be delivered rapidly. So we want to think about that as well. And then finally, the right documentation. As you've probably heard many times, when it comes to documentation, if you don't document it, it didn't happen. So we want to make sure that we do document it, and that we document it correctly. And if you make a mistake, you don't want to try to cover up that mistake by changing your documentation. You have to document what happened. So this would include making sure that you report appropriately any medication errors that have been made. So make sure that that is something that is done with integrity to make sure that the patient, their documentation following them through their chain of care reflects what has actually happened. And that's the 6 rights of medication administration. So that's our foundation for giving medicines. Tune in next time as we start to dig into some specific medications that we give here in EMS. I hope that was helpful. We'll see you next time. Please share us with any of your friends or colleagues, and we appreciate it. Thanks.